Welcome to another episode of Tehachapi with your hosts, Key Budge and Corey Costello. Tehachapi is another way the city of Tehachapi shares information with our community.
Welcome to another episode of Tehachapi. I'm Key Budge. Corey Costello joins me again today. Corey, how you doing?
Doing well. Thanks for doing this again.
Hey, I enjoy this just as much as you do.
It is really, like, I was thinking about this the other day. It's a nice sort of, there's so many meetings and Zooms and this and that and the other thing going on. It's nice to say, I'm going to go take 30 minutes and go podcast. It's a nice break.
It is. We get to have conversations that normally we'll have, in passing. Maybe we'll have a part of another bigger meeting. But here we can actually talk in length, in detail about those things with the public so they get a chance to really grasp everything that's going on.
Sure.
And today we wanted to invite Adventist Health Tehachapi Valley back into our conversation because when we had them here just a couple of weeks ago, I mean, this is such a quick turnaround to ask the guest to come back.
Yeah.
But this is because it's evolving so quickly, the situation with the vaccines and what they're doing. So I think it's good because it generated a lot of questions out in the community. And I know that they've been getting overwhelmed with a response.
It's exactly what we said. Everything going back to March of last year with COVID is fluid and rapidly changing. And this was no exception. We had warned everybody in advance the vaccine situation will be fluid and adjusting, and just, be patient because we got a good team on it. So I think we certainly have.
Well, let's welcome in our guests from Adventist Health Tehachapi Valley. We've got Lexi Garrett, Amanda Danlovich, and Christy Foster. Ladies, welcome to Tehachapi.
Hi.
We appreciate you coming on. Last time we got a chance to talk to Josh Pierce, and Josh was explaining the volume of calls that you guys were receiving, that it was huge. I mean, 600 plus calls a day. Where does it sit right now? What's it like? What's the community response been like for you guys?
Right now, we are sitting at 4,043 phone calls to call back for the vaccine.
Those are still have to be returned calls?
Yep.
Oh my gosh.
That's again, we were trying to get that message across to people, but look, they have these calls down to the detail. Like, they know exactly how many, and they're going to get returned.
And then, do you know how many of those are returned? I mean, like duplicate calls where people are calling multiple times? Because the one thing we want to do is tell people to be patient and not fill your lines up with me calling every 15 minutes until I get through. Because I'm sure that happens.
So we do listen to voice notes constantly throughout the day. I want to say I listen to them the most, but once I hear the same name of someone, because you start catching on to their voice, we're like, okay, this is the fifth time you called us and you're on spot 800 and something. Like, just be patient with us. It'll take us like a week or so to get back to you.
Yeah, that's really the message we got to send home early right now in this conversation is be patient, folks. I know it's been a stressful year, and it's understandable. I mean, let's look at, if we look back over the last 11 months of this, our entire lives have gone upside down, right? So, and now there's this vaccine that's there. I mean, this is what we were chasing, and it's now here in Kern County. It's now here in Tehachapi. How do I get my hands on it? Mm-hmm. So I get that anticipation. I get the, that nervous, like, I don't want to be left out. So what's the response been like with the folks that you talk to, and once you get a hold of them on the phone and get that call back, what's it been like for you guys?
We kind of reference it like the golden ticket. Like, people are so happy when we say where we're calling from. They know exactly why we're calling, and you guys are lifesavers. You are literally heaven sent. Like, it's insane. They act like we just cured cancer. It's crazy. I mean, we get it though. Like you said, I mean, people are scrambling to get it where they can. So
I think Amanda said she had one lady dancing in her kitchen right now while she was on the phone.
I called her to schedule, and she said, I am dancing in my kitchen now because I've received this phone call.
Now, how does that make you feel when you hear something like that?
It truly warms my heart, and to know that we are able to help our community so much. It takes us a minute to get back to them, but we eventually do get back to them, and everybody gets that such happy feeling inside.
And I think it's important to point out, it's not just a matter of you returning a phone call. You have to, in order to be able to schedule, you have to have said vaccine, in-house or ready to go. So it's not just, you're just a matter of calling them back and saying, oh, we'll schedule you for 3 weeks from now. You actually have to have the vaccine before you can make the call back, correct?
Right.
Yes. We need to know how many allotments we're going to get from the county.
And you're finding that out a week at a time, is that right? So you find out like, hey, you find out today how many you've got for next week, and then you've got to schedule.
Last week, the 30th, we only did Saturday for 400, and the previous weeks have only been like 90 Friday, Saturday, Sunday each day.
Wow.
We got to bump it up some.
You've got 4,000 plus calls to call back, but you're only going to get who knows how many doses of vaccine. So you can't call back all 4,000 and say, hey, I'm going to put you on the list. You can, you've got 100, 200, whatever the amount is. That's how many people you got to call and get set up.
Exactly. We have to wait until we get that allotment to know how many of our patients we can call back and schedule.
I think that's the message we've been trying to help get out to folks is like, look, if you've called, you are in line. You're already in line. There's no reason to call back. There's, and you can get impatient, but it doesn't really help because, again, they can't call until they have the vaccine. So you are already in line. You're in the queue, and you'll get a call when the supply is there.
With that being said, when we talked to you just before we started to record, you said that there's something that's changed that launched today that is kind of a game changer for some folks. Can we talk about that?
Yes, this is very, very exciting. We were able to work with one of our partner companies, and they created an online self-scheduling tool. So now our patients can go in, they can still go to Kern Public Health, and like they would online register, they can go there, and if they're ready to schedule their vaccine, the link is right there for them to click on, and they can go in, answer a bunch of questions it's going to ask them, but then they're able to pick their day and time for their coming up appointment.
So is that probably the fastest way to get scheduled then? Is that they go through that process?
Yes, exactly, through that. So, and if they don't see any appointments popping up, it could be because for that weekend, the appointments have all been booked. So we do ask that they just check back and keep checking back until they're able to get through and get their appointment scheduled.
Now, how many days a week are you vaccinating right now? Is it just on the weekends?
Right now, it is just on the weekends. We are working to hopefully get it to 7 days a week. And then we are launching a mobile vaccine clinic.
And then the 7 days a week is going to depend on how many vaccination doses you have available. So
Yes.
Right now, you're only getting enough doses through the state to the county into your hands to just take care of the weekend rush.
Yes, exactly.
So this crew we're talking with is a big, they are the sort of heartbeat of this operation. And, we've talked to other folks in the public health sector during this pandemic, when we've heard this is like a 100-year event, right? And so does that hit you all? As you deal with this work and as stressful as it can be, you are really, you're effectively a part of history and being a part of correcting history, I guess we can say as well for the better. So does that kind of help motivate you a little bit, knowing that the scope of this whole pandemic?
Yeah, honestly, it does. There's 3 of us and there's thousands of people trying to get on the list. And we work so much overtime. People don't understand. They're like, why are you calling us? And it's Sunday morning. We're like, we're here as much as we can be because we understand, it's the elderly of our community. So we're really trying to help them get the vaccination too. So we're working a lot of overtime and putting in a lot of hours. So.
Now, and one question that we got via social media that I want to throw your way, and it's regarding seniors 65 and over. And if they've already received round 1, okay, so they got in line, and you guys have already vaccinated them with round 1, they're curious as to how far out before they get that booster, that follow-up, when will they be scheduled? How will that take place? Have you guys worked that into your logistics yet?
So right now, we are working on everybody who came to our first weekend that we did vaccines. We have February 13th, and we're scheduling just right now our second dose people who need to come in from that first weekend. So we're calling everybody who needs their second dose that came to us for their first dose and working on getting them scheduled for the 13th.
So that February 13th will be just a booster round only day to make it.
That's what we're looking at. We're looking at filling it with everybody that we need to get those second doses in.
Okay, so again, we want people to be patient. So if you got round 1 and you're hoping to get round 2, you will be called. And they're setting up special days just for that to occur out at Adventist Health Tehachapi Valley Hospital. So be patient. And if you've called and you're one of the 4,000 in the waiting list, it's going to happen. You know, you gotta be patient, or you can actually, I guess, go over to the online version and try and self-schedule, but that's going to be limited also. I'm going to guess that every week you're looking for maybe a new set of rules that are coming, or the operating agenda is going to change a little bit. Has that kind of been it? It's been very fluid and constantly evolving?
It has been. People ask us on a daily basis, when are we moving into the next tiers? Do you know? But we know just as fast as everybody else finds out.
And right now it's strictly healthcare workers that can show proof they're a healthcare worker, and then that over 65 only. No one else.
Emergency services.
You know, that's a lot of people. I mean, it seems like, okay, that's just a small category, but there's a lot of people that fit into that criteria that are first responders that are in that healthcare industry, or they provide emergency medical services that need to get the vaccine. And we've got a lot of people age 65 and older. You know, it's and here in Tehachapi, I mean, we were known as a retirement community, even though our demographics constantly change. We still have a lot of people in that fit that category.
And remember, there's folks calling from all over the area,
right?
You know, not only Tehachapi, but surrounding communities and different counties that are trying to get themselves a spot in the line somewhere too. So there's that wrinkle in as well. And
you can't turn someone away from LA that calls. Is that right?
Last weekend, we had somebody come from just about Oregon.
Wow.
Yeah. But on our online registering, it does only include the surrounding zip code.
Sure.
So we are trying to take care of our community and get everyone in.
Wow. But I mean, that just, it wows me that someone would drive 13, 14 hours to come down from Oregon to get a shot that, you know, how many vaccination locations do they pass to choose Tehachapi? Maybe they had family here and that was the tie-in, but oh my God.
That's crazy.
I can't fathom.
I mean, we've heard the term vaccine tourism. And so, I mean, that apparently is a thing.
Yeah. I guess I'm just not in that mindset that I would be willing to drive 14 hours to do that.
Yeah.
But I guess there are, and that just shows the mindset of the public. And you guys are dealing with people in all different phases of, I don't know, stress, I guess is probably the way I would describe it best. Yeah. What's that been like?
Ups and downs, I guess you could say.
Yeah.
Working 10, 12-hour shifts sometimes isn't the best, but getting that positive feedback from the people that are so happy to hear from you. When we did our 400 people that day, I was the last person for the waiting period to make sure there's no adverse reactions. And I just got praised so much because they were so happy to be getting their vaccine done when we did the drive-through 400 people last Saturday on the 30th.
Yeah, we've received emails, about the positive reaction that everyone's had that has received the shot, and the praise for Adventist Health emails, and people on the streets and in city council meetings it's been brought up. So yeah, kudos to you all, because it's resonating in the community. Those that have been serviced are very happy with with the results thus far. And
I hope you know that those that decide to vent on you when they get to you, it's not personal. In my past profession, being the target of venting was a part of the gig.
Yeah.
Right. So you kind of roll with it and you go, okay, all right. And you allow them to vent, and then you move on. And then when you get those positive people, it's like, okay, good. It just kind of makes everything better.
Yeah.
So
it's the best feeling.
Well, is there anything else that we want to touch base on, or is there anything else that's coming up, or things that we need to remind the public about?
So we just want to remind everybody to mask up, remember to wash your hands, and social distance.
Okay,
and we will give them those phone calls.
Yeah.
We promise.
Right. Something to answer.
Just be patient. We're getting there.
Let's share the information again with the new system that's in place. We want them to go to the Kern County Public Health website, and then they want to check on the vaccination locations, and then the map is going to pop up. We find the location that is in Tehachapi for Adventist Health Tehachapi Valley, and when they open that up, there's something new that took place. And what are they able to do now with that once they open up the Adventist Health Tehachapi Valley dot?
they will be able to choose to do the self-scheduling online app.
Excellent. And the phone number for folks to call if they want to maybe be the 5,000th person in line, what is that phone number that we could share also for that second option? Because some people aren't as computer savvy, and the phone is their only option.
Right. Yeah, that number is 661-771-8400.
Thank you so much for everything you're doing. This is Lexi Garrett, Amanda Danlovich, and Christy Foster. We appreciate your time so much and everything that you're doing out there, and we just want to say thank you.
Yeah, thank you. Thanks.
We're glad to be on your show.
I'm super encouraged though, because we're talking to you and folks will be listening to this, but we see you on camera and you're smiling, you're upbeat, you're not beaten down, you're excited about this work, and I'm encouraged that we have these people in charge of vaccine distribution because they're in it for the right reason. So kudos and thank you again for your work.
Yeah.
Thank you, guys.
Thanks.
Corey, man, I'm still that number. I mean, it staggered me when Josh said 600 calls.
Yeah.
And now we're almost at 5,000 calls to call back.
Yeah.
And how long will it take for them to get 5,000 doses to catch up on those calls?
Yeah, that's the thing. And especially when the sort of frustrating part is when you hear about, the states, oh, we're going to launch a mass vaccination site at the Oakland Coliseum or Cal State LA. Well, that's great. But again, the state's still lacking the vaccine to do so. And the same thing happens. What about these communities like ours, right? So I think some of that, a lot of the time, and it's nothing new, right? Small communities within the state, obviously, a lot of the time, we're kind of underneath the larger cities. But I hope when I see that means, okay, there's going to be more vaccine coming on the market soon, so to speak, to not only serve those mass sites in the large cities, but also the communities, that are served by us, like Adventist Health. So anyway, those are some of the factors in there. And yeah, they can't even return the phone call until they have the dose,
right,
in hand for the most part, knowing, okay, we got this many doses, we can call this many people back.
And the fact that the follow-up, they're going to begin February 13th with the second round, and that's going to be scheduled. And that day will be dedicated just for those that have already received round one. This will be the follow-up booster vaccine, and that's for our first responders that qualify and also our seniors at 65 and over. And that staff that just talked to us is going to be calling. So when the phone rings, if you don't recognize the phone number, pick it up.
Right.
And I think that was one of the things that Josh said too, is that, they start going to voicemail because you're getting a phone number that's calling that is not recognized, and it's probably coming from a truncated line. So, it's not going to maybe be the general hospital number.
Yeah. So
you program in that number, and that's not the one that's going to be calling you back. So answer the phones if you're on this list, because it will help speed things up.
And you add in that, you brought up that second shot aspect too. So once you have 400, 800 people vaccinated, they're not, they're also sort of in the queue now for shot number 2, because it's that, what do we do? Are we worried about getting more first doses out, or do we want to completely inoculate that first group that already came through, and have shot number 1, then that way they're off the books completely. So that sort of adds up the traffic jam. And this is a statewide, nationwide issue that's happening with that. So, when you hear about 300 million doses, for example, that would basically be 150 million people, right? Because it's 2 shots per person. But I know there's some other developments of some potential one-shot vaccines out there that haven't been approved yet, which could speed this process up too.
Yeah, that might be when my category gets reached. My tier.
I'm in the young and good-looking tier. It's going to be a while. Just going to wait my turn.
I don't even have a response for that. Well, folks, hey, we invite you to send us your questions, because Corey, myself, and Greg would love to get your feedback, answer your questions. We did that on the last episode. We grabbed a couple of frequently asked questions and shared that. So I know that coming from the Facebook regarding, happened to be just, on one of our last posts about Adventist Health, they said, hey, when is round 2 coming? Yeah. So, that was a nice that we were able to take a question from the community and directly feed it into one of our guests. And the question, again, for those that may be interested, because there's a lot of people that fall into this category, if you've received round 1 of the vaccination, when will we be scheduled for round 2? And that will happen very soon. They've got a date set aside, February 13th, at Adventist Health Tehachapi Valley, where round 2 will be given just on that day. So that is going to take place, and they will start calling.
Cool. Yeah, absolutely.
So we invite people with this new the new self-scheduler is to go to kernpublichealth.com, click on the link that says COVID-19 vaccination locations. It opens up a map. Find the Adventist Health Tehachapi Valley. The form there has now been updated to do self-scheduling if they have available slots for you to schedule yourself.
Yeah.
You can at least fill out the form, and that is done. But you can, if they have times available, you can already self-schedule too, which is nice.
Yeah, another tool.
Yeah. So, Corey, anything else we have going on around town, things that we want to share?
We just a reminder, if they haven't, folks haven't checked it out, we did have a new addition to our website recently with our economic dashboard and economic or demographics and economic opportunity dashboard. Check that out. Talks about really what the business in the city of Tehachapi serves in terms of total people and that surrounding communities. And there's new demographics and sales numbers. So if you're a business owner or thinking about starting a business or, check that out. You might get a better understanding of your customer base or the potential customer base for you in the city. And then our finance department won another GFOA award, the Governor's Finance Officers Association, for the second consecutive year. And that's for the financial report that they put out, the budget presentation, actually, I'm sorry.
Yeah.
They won them for the financial report in the past, and They won it for the budget presentation. And every year they make that thing easier and easier to read. And again, second straight year they got an award for it.
Yeah, that's back-to-back years for both of those categories. So Hannah Chung, the finance director, and her team have now received 4 awards from GFOA.
Yeah. And
both of those are back-to-back winners for last year's budget and this year's budget. So congratulations to everyone on our finance team.
Yeah, it's super easy to read, in terms of finding out all the, funds, and it's on our website. You can see where all the money's being spent. And they really take pride, too, in the layout of it now. They worry about year-round about photos. They see a photo. You deal with it all the time, right? Hey, Key, can you send me that photo for the budget? Because they want to put that in their budget book and showcase Tehachapi, so it's kind of cool.
Yeah, and because the photos help tell the picture. So they've got the numbers, the hard numbers right there, and as they describe whatever the project is or whatever, and then they got a photograph to go with it. Yeah. It's a very easy to follow, flowing, document. So congratulations again to our finance team. It adds to our transparency as a local government.
For sure.
So folks, send us those questions, comments, your thoughts, show ideas. We'd love to hear from you. media@TehachapiCityHall.com, and we'll look forward to talking to you again soon. Thanks for joining us.
Tehachapod is a conversation about Tehachapi designed for the people who live here or who would like to know more about this mountaintop community. If you have a question you would like answered, email media@TehachapiCityHall.com. We will try to answer it on a future episode of Tehachapod.